Okay, well, we will go ahead and get going. Welcome again, everybody, to our weekly City of Bloomington, Monroe County, IU and IU Health assessment on the efforts to combat the COVID pandemic here locally. As always, I am Chuck Carney, Indiana University Director of Media Relations, and we have the City of Bloomington Mayor John Hamilton joining us here, as well as Monroe County Commissioners President Julie Thomas, IU Health South Central Region President Brian Shockney, Monroe County Health Department Administrator Penny Caudle, Monroe County Emergency Management Director Allison Moore, and IU Assistant Vice President for Strategic Partnerships and the IUB COVID Response Unit Lead, Kirk White. To start off with, we will go to the mayor for opening comments.
There we go. Sorry. Thanks so much. I will just give a quick update this week. Thanks again for everybody participating, and Chuck for managing this three-ring circus every Friday. We are wanting to share what information we have. I'll give you a quick update on the city executive order. We continue to get reports of violations of the size gathering order limitation of 15 for private social gatherings. Though we've had a little bit lower numbers, which I'm pleased with in terms of runs we've had to do. We did 13 runs on calls for overly large events over the last week. That compares with 62 total BPD runs for that purpose since August 21st. So we've had a little decline. We continue to address those and work very closely with Indiana University Police Department, and we appreciate getting notice about that. I also will note we had 6 exemptions that were sought this past week to that limit on private social gathering size. That also is down a little bit. We had a couple dozen in the first 2 weeks and down to 6. We have been able to approve each of those in working with the hosts to make sure they have appropriate protocols in place and protection. So we do encourage anybody who's seeking to have a larger gathering, whether it's a wedding, a similar social gathering, maybe a Bible study. We've had some religious gatherings that have sought, and we appreciate the notice, and we'll work with you to get that approval. I don't have different data from CVU this week from what we had last week, which was the same indicators of showing concerns in certain areas of high density student, but not really in the other community non-student areas of the community so much. So that continues. But of course, we have great concern that continues, all of us seeing what's happening in different places around the country, including particularly universities and university cities, whether it's now University of Illinois, University of Wisconsin have had to take major steps. We continue to work very closely with the university, appreciate their intense efforts. It's still touch and go on what will happen, depending very much on behaviors. So we do dramatically continue to emphasize the importance of masking and physical distancing and good hygiene. We see bad episodes sometimes, for example, on the lake that require response, and it may take a little luck, but we're going to keep doing what we can, and we'll appreciate continuing to get the data as we do regularly from the health department and the health systems in the area. We'll continue to monitor that, and I'll be happy to take questions at the appropriate time.
Okay. And speaking of the health department, let's go ahead and go to Monroe County Health Department Administrator Penny Caudle. Oops. Penny, we're still muted there.
All right. Well, I was just saying that you caught me off guard. So
sorry about that.
That is perfectly okay. I'm happy to be here with you again today and appreciate the opportunity. I think for me today, the biggest thing that I think has been on everyone's mind has been the state's dashboard and looking at the numbers and all of that. And certainly we have been working with the state, the universities have been working with the state to ensure that all of the reported tests, both negative and positive, are reported and make their way into the system that ends up on the dashboard. Today, we did see a big chunk of those come into that system. I don't think that it's done. We will continue to see that rectified and become more streamlined. Our overall positivity rate for the last rolling 7 days is down to 8.2%, where it had been up. And, again, we say every week and have said for months that we look at a variety of information. And I cannot stress enough that there is not one single number, one single metric that can be used to make decisions on. It is the full picture, and we have to look at everything. Certainly looking at our positivity rate is one of the important things that we look at. It is not the only thing, but it is good to see that whatever the glitch was holding up those tests from IU, and I want to say that it was not because they were not being reported, but it was, and I can't tell you exactly, but I feel very confident in the conversations that I have had with everyone. It has just been about systems talking to systems, and sometimes technology works wonderfully and sometimes it has challenges. And I think that this was a challenge, but there's an enormous amount of testing being done, we know, on IU campuses, and I think that that just presented a challenge. And so we will see those continue to kind of even out a little bit. In terms of our complaints, we continue to get 20 or so. Last week, I think it was 30 something. This week, it's been around 23 complaints that we have followed up on and went out on. We continue to get exemption requests. And again, like the mayor said, most of them tend to be for things like wedding receptions, but we also see people planning for fall events and getting those. We are working with the schools on sport plans and how we move into the fall and winter and coming indoors and what those plans for safety look like. We continue to work with the students on campus, specifically in the Greek houses, and how we can work together with IU to help those students. So that really is the bulk of what I have. I will just end by saying again that we all need to do our part, that we will get through this. We'll see fewer infections if we each do our part in protecting ourselves and others. And I guess I have to say also, I've heard this more and more, people talking about, well, I'm just with my family, or I'm, it's okay. I know them, and they worry about the people they don't know. But we need to assume that we could be infected or that those around us could be, and we need to take precautions and not just assume that that other person sitting across from us has been taking the same precautions that we have. So we all need to do our part and stick in this together, and we will get through it together.
All right, thanks, Penny. Let's next go to Monroe County Commissioners President Julie Thomas.
Good afternoon, everyone. Thank you for the invitation to be here today. First, a bunch of thanks to everyone who work so hard in our community, our healthcare workers who continue to do their part and more, and also all of those essential workers. We appreciate you, and thanks to everyone who's wearing their face coverings and practicing social distancing, even when others aren't. Sometimes peer pressure can be a good thing or a bad thing. So, but I do want to just note that we at Monroe County government are continuing to provide support, direct support for local businesses, social service agencies, and residents. In terms of businesses and social service agencies, we are providing CARES funding directly for those who have COVID-related expenses that have not been covered by other sources. These are non-payroll expenses. And to date, we have distributed over $71,000 to area businesses and social service agencies. We're really proud of that. And we've also, as part of that CARES money, we are also providing funding to the Monroe County Public Library, $26,000, a little more than that. Also a note that for residents who are struggling with paying their basic, with paying their basic necessities, Every county resident lives in a township. We have provided, Monroe County government has provided township assistance funding so that they are going to not run out of money. They're going to have the backing of Monroe County government. And so if you are struggling with rent, utilities, or anything like that, please contact your township trustee. The whole list of them is available in any of our minute packets, our agenda packets at the end of the minutes from any commissioner meeting. And all of those names and phone numbers are there as well. So please visit them before it's too late. We're really proud and happy to provide that. So just a note that on the exemptions for the gathering size, on complaints, and to sign up even as for alerts, as all of that is on the Monroe County homepage, co.monroe.in.us. And I am here to take any questions, and I appreciate everyone being here today, and thank you for hosting us, Chuck.
All right, let's go to Monroe County Emergency Management Director, Allison Moore.
Thank you, Chuck. I'd like to start with it being 9/11 and take a moment to thank our Monroe County first responders. Interesting that Mayor Hamilton gave some statistics of the different calls that the police department had been on due to COVID-19. I just am reminded today about the strength of our country and the strength that the first responders had to have 19 years ago today. And I'm super impressed with the strength that our first responders have today and how they're dealing with completely different circumstances, but circumstances nonetheless that we all wish we were not in. And how blessed we are that we have wonderful first responders that are taking care of our citizens. And so I wanted to just give a blurb out to them. They are just wonderful individuals that give. So I would like to report that we still have 16 spots open for our September 29th blood drive. They are still doing the antibody testing. So if that's something that you wish to have, it would be a wonderful time to go to the redcross.org website and make an appointment to give that donation. On the website, it only goes out 14 days. So you actually have to go to the calendar and select the September 29th date. Most of the time by now, our blood drives are full this far out. And so we really want to push, and we really want to make sure that if we're going to have the volunteers and have the drive, that we get those spots filled. And so I encourage individuals to go and sign up as soon as they can and make that. I challenge them to be able to make that donation if you can. We also still have masks available. I know I announce that almost every week, but there are still people still picking those up. You have to pick those up by appointment. The locations where you can pick those up are on our county website, and you can call any of those numbers and they will be more than happy to provide you or your family a mask if you need one. That's all I have today, Chuck. I'm happy to entertain questions at the end. Thank you so much.
Okay, let's go to Indiana University and Kirk White.
Well, good afternoon, everybody. We appreciate everyone's interest in providing their updates today. And I think from the university's perspective, I can update you to let you know that our mitigation testing is still continuing on the fast pace that we ramped up to. We're right at testing about 10,000 people, students, faculty, and staff all included this week, and we'll continue along that pace. Eventually, we'll get to an even higher number because we expect in November to stand up our own lab here in Bloomington that will allow us to process our own tests, and that will give us some additional capacity. When you look at how much testing we're doing, it's really part of our bigger plan and solution to be able to find where infection is occurring and be able to respond to that. And then our contact tracers work to make sure that those folks get into quarantine and isolation. And that helps us contain infection rates. And I think that's why we've so far been able to do better than many other institutions, because only the University of Illinois is testing more than we are in all of the Big Ten. We're the top two. And we adopted that policy last summer and have gone to great effort and cost to make it happen. And this is why it's allowing us to manage this pandemic as best we can. The important message that I wanted to convey this week is that we're going to have a slight change in our dashboard. We're going to move the dashboard posting, and it will be updated every Wednesday now, not on Mondays. The reason we're doing that is because we want to be able to provide a more complete picture of the testing results across all of our campuses. So now the dashboard will be updated on Wednesdays instead of Monday. This will allow us to include more test results from the week prior, as these results take a few days to process. Remember, they're saliva tests, and the saliva tests are then sent to a lab out of state. It takes a couple of days for us to get all those results back, and then we have to analyze them to make sure that we've got them all in the right places. For example, since we're testing all of our campuses, sometimes some of the Bloomington results might get to IU East or vice versa. We've got to sort all that out. So this will give us some more time, and our public health experts, the doctors team that we have that's working on this, to analyze the results and share this important context with the public. So I'm going to post here the link to the dashboard and encourage you. We've got, of course, last week's results are on there right now. And then next Wednesday, this week's results will be on there. And I'll just close by saying there's a lot of talk about people falling into what we call pandemic fatigue. And boy, we don't want to go there. We're still in the midst of this. And so the importance of doing all those things we've learned to do is just as important as it was from day one. And it's going to be even more important as we get into the fall months, when more events are held indoors and there's a greater chance for spread. So let's put a stamp out on pan fatigue, and remember that we're still all in this for the duration. And along those lines, one last thing I think I mentioned last week, but we are fast in our preparations now for some massive mass inoculations, immunizations for the flu, which will then put us in a good position to follow right on when the vaccine for COVID-19 it reaches us. Thanks a lot.
Okay. And now to Brian Shockney from IU Health.
Thank you. Thank you for the opportunity. Just a couple things quickly here. Indiana State has surpassed 100,000 positive COVID-19 cases. The State Department of Health reports over 1 million COVID tests conducted. So as we've continued to see this mass testing, not only at Indiana University, but across the state of Indiana, and testing has become more available over the past 6 months, we're continuing to get better data on the pervasiveness of this disease. As we start to enter flu season and RSV season, we want to continue to remind people, as was stated with the pandemic, that we continue to need to practice those things like wearing masks, getting your flu vaccine, washing hands regularly, and social distancing. Flu vaccines have been delivered to most people and locations and organizations that are giving them out now. I got my flu vaccine last week with my doctor's appointment. And so we have got those flu vaccines available, and we encourage people to get those. Our numbers continue to be steady. As was on the screen, we continue to see that steady number of inpatients across our region, and that's a good thing. We have not seen a sharp increase in any way, and no significant fluctuations. So we've been able to manage the inpatients across our region. And the final thing, I don't want to end on a sober note, but over the last few months, I continue to challenge us to consider the toll that the pandemic has taken on our mental health, and on the importance of taking care of ourselves. You know, we've all made sacrifices. We've got parents who are shuffling school children and work, and Also isolation. We've got people who are isolating because of the flu. And this week has been especially difficult for our IU Health family because we lost one of our own. And we grieve alongside the Bloomington community as well. You know, this event compelled me to step back and reflect even more how we can make a difference for others. We all suffer some level of negative thoughts at times, and it's important that we openly talk about our feelings to someone and that we connect with others. So I'm going to, one more time, in this news conference, encourage those of you, all of us, who are struggling during this period of time, that most of us have never lived through something like this in our lives, to reach out, be sure that we are taking self-care, that we have self-awareness, that we're connecting with our loved ones, and that we are connecting with those resources that are available to us. This is September. It is National Suicide Prevention Month, and we need to be sure that we are aware of that and reaching out to those resources. And if you're an employer, if you're a public health official, if you're in the news media, we would encourage you to put those resources out on your sites. We would encourage you to run stories that encourage people to seek help to those sites, such as the Indiana Suicide and Crisis Hotline, 1-800-SUICIDE, or 1-800-273-TALK. Thank you.
All right. Thank you, Brian, for those important words, and those numbers are now up in the chat. So we now can go ahead and start with questions. We do have one from the B Square Beacon and Dave Askins. For Penny Caudle, 235 cases is a whopping big number. Do we have any clear understanding of how many, if any, of today's new positive cases are due to the lag in reporting by the state of the university's numbers, or was the dashboard glitch only about negative tests? So there's more to this question. I'll read it, but I'll if you need it back again, I'll read it again. If the dashboard glitch was related only to negative tests, is it fair to conclude that yes, all 235 of those cases reflect routine reporting? If the 235 don't reflect some kind of reporting lag, then seems to like a very big number. Are we still okay for capacity on contact tracing given that big number?
Wow, Dave, that's a lot. It is a big number. And I will tell you that when I saw it, my mouth dropped a little bit too. Certainly is a big number. There was a wide range. So it appears certainly it is more than just the negative test, and perhaps more than just, a single lab or a couple of labs. The state has not reported to us exactly the details of that, so I don't have any specifics that I can share with you about that. Certainly, we know that our IU tests had not been all added in, and that was very much a large number of negative tests. There was an enormous amount of negative tests that came through. So we'll be working to try to find out more about that, but I don't have a really clear answer about that. Because some of those were older tests, doesn't necessarily mean that that there were 200 or over 200 new tests this week that had to be contact traced in the last day or two. So we'll have to kind of work through that. Again, some of those would be done by the state, some would be done locally, some would be done at IU, depending on who they were and where they were tested and where they were from. So yes, and to be perfectly honest, I was on Noon Edition when I was able to pull up that the map today, so I have not had much time to dig into it any further than that.
Okay. Question from Adam Pinsker at WTIU, and this I'll throw out to our Monroe County folks here as well, but I'll start with the IU part. Will there be any sanctions against the people who appeared on boats on Lake Monroe last weekend who are not social distancing? That refers to what is assumed to be student-aged people on these pontoon boats on Lake Monroe last Friday afternoon, shortly after we were done last week. Kirk, I think it's fair to say that the investigation still is ongoing. I don't know if there's anything new to report on that.
Not that I know of, but I do know that the jurisdiction that investigates that, probably DNR, because it was on the lake. If they report back to us that it was students violating the policies, then we will confront, and there will be disciplinary action by our student affairs officials.
Okay. I don't know if any of the Monroe County folks want to chime in on that, or.
Well, sure. What I would add to that is just kind of what Kirk said. It was on the lake. It is DNR. It is not subject to either the county or the city's gathering size limit. I guess I would say this, that the behavior that we saw certainly is not following the guidance that we would want anyone to be following right now. We want people to take precautions to, work in, avoid large crowds, especially when we're close. We can't maintain that 6-foot distance, to wear masks as much as possible, especially when we can't maintain that 6-foot distance. But I also want to caution people on calling out who those individuals might be when we don't really know that. And we see people every day who make good choices and some people who maybe make less than ideal choices from our perspective. And they are in every age group, in every corner of the community and the states and across the country. So we know that we have a lot of students who are taking this very seriously and are following the rules and doing their very best. And I just want to caution us about making assumptions about who people are, what they're doing, without fully knowing that. So yes, what I saw, there were concerns that I had in those pictures, but I want to be very cautious about who it was and what rules were being broken.
Yeah, Mayor Hamilton.
Well, I just would add, it was clearly irresponsible behavior, and we certainly appreciate the good behaviors that we see, but we need to call out the irresponsible behaviors. And I know Bloomington Police has indicated this is under the jurisdiction of DNR, and we have urged strongly that they take actions to assure that even under the state's rules of 250 limit, they still require appropriate distancing and masking, which was just not followed there. I do hope that we can continue to encourage that enforcement, and as well encourage IU, as Ms. Caudle said, I don't know who the individuals were, but somebody rented the boat and you can find out who the individuals were. And if they were students, that gives an ability to reach out, whether they're IU students or other students, for somebody to reach out and talk to them. If they weren't students, we still know can know who was renting the boats, and jurisdiction is tricky there, but we continue to encourage DNR to do what they should do, which is to indicate that's clearly irresponsible and not appropriate behavior given the orders that are here. And we know it does not take many events like that. If we have bad luck and one or several of those people were actively infectious at that time, you can have really bad results and spread. So it's a reminder that 90+% can be doing good things, but if 5 or 10% are doing bad things, it can really cause difficulty. So we do appreciate all the collaboration on this, and just remind individuals that it is behavior like that will make or break our path ahead. So it was a little frustrating to see, but again, we do thank all those who are doing the right thing. That's going to help us.
Question from the B Square Beacon for IU. Are there some records that the university could release proactively to show definitively, yes, Indiana University is reporting all its data to the state in a timely fashion, time-stamped email messages or whatever records might help show that? Kirk, I'll toss it to you. And just, we have to report it to the state. It's that there's no question on that end. We are doing that.
We sure are. And in fact, this from our side, the right now, all the mitigation testing that was post-arrival testing is all being processed by Vault Medical, the contractor that we have worked with that is from Rutgers University, in fact. And they actually are required to submit that back to the state. So we know that that's a requirement. They're the ones reporting it. For us, the arrival testing that we did with the Becton-Dixon tests, the nasal swabs, yes, we have reported all of that. We're required to. It's part of our policy. Now, I suppose there's probably some paper trail in all this, but as I have asked our teams, they said yes, we're required to report all this, and kind of going to the next question there, will we be doing a daily update on the dashboard? That gets a little difficult because, well, I wouldn't say it's more probably inaccurate than it would be difficult. The problem is what you want to do with an update like this is provide a trend line. You want to be able to look at all the data that's coming in. And if we did it day to day, it would be skewed, just no question about it, because the way we're building the mitigation testing is a lot of it's a random computer generated message that goes out, show up, here's your appointment, show up to go get your testing done. And that's sent to students, faculty, and staff. But in some cases, we weight that amount of testing on a particular day. We may have gone outside the random and weighted a particular area, a housing unit that we suspect there, because of contact tracing, we suspect there may be a problem. We have the ability to weight that higher that day. So if we did the day-to-day stuff, it wouldn't show the accurate trends. It might show ups and downs that would give people the wrong impression, depending upon on how the tests were weighted each day and when we got the results back as well. So that's why we've gone to this week-long thing, so that you can see an accurate trend for the campus as a whole.
And again, to reiterate what you said earlier, that will be coming out on Wednesday, starting this coming week, instead of Monday, again, to get the full week of results in there. Call out for questions here. I don't see any other ones here, but I'm going to do my vamping here as I allow a few moments for consideration of other questions, as we still have about 10 minutes left here. Again, if you want to see where the IU dashboard is, that is on the fall2020.iu.edu page, and that update will be up there on Wednesday. And once we have that time set on Wednesday, it'll be around the same time each week as we've been doing on Mondays as well. So again, putting a call out, somebody can ask a question here online if you wish, or on chat. Yeah, Mayor Hamilton.
Chuck, I'll just add both Allison Moore and Brian Shockney's points. So important about 9/11 and first responders, and then the tragic events over the Labor Day weekend. Just reminding us, and with media on this call, and those of you who have megaphones or print outlets, to remind people that, you know, we don't interact as much as we used to. It's true with families and school children. It's true with fellow employees and friends, and that we don't, of course, know any direct linkage between any of this. And we had 2 suicides over the weekend, one with that terrible triple murder apparently affiliated with it. And we don't know the details of that, but just the importance of continuing to listen to each other, look out, ask for help. You know, there are data that suggests this is a growing issue, and that's something that we, again, individual behavior of trying to watch for signs of problems and encourage destigmatize, just welcome the reach out is so important. So having the health and the emergency professionals, as you both did, emphasize that is really helpful. And I'll just add my thanks to both of you for making those points and reminding all of our public of that. And these are hard times we will get through, but we do need to watch out for each other every day. Thanks.
Okay. All right. Well, I am seeing no other question. Dave Askins gets in just under the wire. Does the general election, this is for IU, does the general election date factor at all into game planning various scenarios for keeping the campus open and students in Bloomington? So,
The general election date, no.
I think the answer is probably no.
No. There are so many variables that we look at to determine whether campus operations should continue or be modified. But the general election is not one of those. We, of course, encourage our students to vote. Whether they vote here or whether they vote at home is up to them. And on my personal perspective, from being a former elected official, is that most of our students spend most of their time here. And if they spend 9 months out of the year here, it'd be a good idea to get registered and vote here. It's easier too. You don't have to worry about the absentee mailing delays and those kind of things that may occur. So the most important part is to take this time right now and get registered and take advantage of the ease that it is to vote here locally. A little different this year, but it's doable. And getting up to speed with the election, with the both the local, state, and national races, that's really important for all of our population, particularly our students. And I think they're going to be particularly interested this year. It always, in a presidential year, the student population percentage of voting always goes up because our students feel nationally connected, perhaps more than they do locally at times. And so we would expect that to happen this fall as well.
Commissioner Thomas, you often remind us, it would be good to remind us about registration and voting. That was like a lead-in for that, wasn't it?
Yeah, it kind of is. Go check your registration, make sure you're registered. Go to indianavoters.com, and you can also check out the monroecountyvoters.us site. If you're interested in becoming a poll worker, that would be great, especially if you are a resident outside of campus in case campus closes, which we hope it doesn't because we love having the students here. But we do need poll workers. We always do. There's all kinds of information on that website, including your ballot, where you can vote. But it's important to note that you have to register by October 5th, and early voting in person begins October 6th at the election center. And all of that information is available at both of those websites. And it's very important to get involved and read up on the issues and ask questions. That's what we are all here for, to provide that information that anybody has.
okay. Thanks, Julie. And I'll add one last thing relating to IU and the scenarios to keeping campus open to in-person instruction. We're asked this question all the time about what we would do, what the factors that we consider are in considering keep the campus open or not. There is a video on the fall2020.iu.edu site with Dr. Cole Beeler speaking directly about what those factors are. And it's a short video, and that is where we discuss some of those. It's not just one number. It's not just two numbers. It's quite a few, and quite a few factors that we do consider in that. Yes, Mayor Hamilton.
Sorry, I'll just add, some of this happens while I'm on this call, but I just wanted to report CBU, the utility sampling that we're continuing to do. We have seen some increases in that. It's really difficult to get to actionable information, but we're working hard to do that. But I do want to report that we're actually trying to increase that sampling, because over the past week, like the data that you get from other sources, we've seen some rise in that background incidence of viral infection. So we're going to continue to do all we can to identify where and what we can do about it. But I just want to let people know that testing is going on, and whenever we do get actionable information, we'll be sharing that with the public as well as with, of course, this health group to help do some of the planning that we can do. Just wanted to. Sometimes that happens while we're on, so just got some new information. Thanks.
Okay. All right. Well, with that, I will go ahead and wrap things up, and we will be back here next week again at 1:15, and we will talk about our latest efforts at that time. Thanks for everybody joining us on the call today.
Thanks, Chuck. Thanks, everyone. Be well.